Good morning. So I'm Dr. Dawn, Psych MD, your most influential double-boarded child, adolescent, and adult psychiatrist. And I'm here today with the Dr. Sasha No.
And for all of you, those of you that are joining my live, see, we are double living today. Dr. Dawn's living on her page and I am on mine. And for those of you who don't know me, I am Dr. Sasha No. I am a dual doctorate, board-certified, award-winning physician, researcher, best-selling author, international speaker, and medical cannabis expert. And I am here with Dr. Dawn Psych. She is an international expert on ADHD, and we are here actually to talk about medical cannabis and
medical
anxiety.
That's
oh my
right.
gosh.
Yes.
So hot topic, right?
Very hot topic, especially for very uncomfortable about how to engage treatment with patients who may be on medicinal cannabis, tropic medications, so
right.
medication management for mental health disorders such as anxiety.
Right, and so the reason we wanted to have this talk today is because I get patients who come to me seeking medical cannabis for anxiety. You, as a psychiatrist, are seeing patients who are most of the time taking cannabis in a abuse, dependence, addictions, substance use setting. Some of them are self-medicating. However, as a psychiatrist, you're seeing a percentage of the population that is probably the most complicated to treat when it comes to medical cannabis. And I really want to get that message across because this is an area where, while we do know cannabis can help patients with anxiety, when you look at the brain and what you do, my gosh, like your knowledge of how things work psychiatrically, how those neurotransmitters work, how our feedback systems work in terms of reward and dependence and abuse, it's intricate, it's complicated.
It is very complicated.
And so we have to consider all of that when we have patients who are seeking help with cannabis. That's why we want to talk to you guys today, because this is a really hot topic for us. And so, you know, I want to say I have patients who come to me looking for help with medical cannabis for their anxiety. And tell me about the patients that you see coming with to you.
So it's interesting that you mentioned it's complicated because some patients come to me because they tried everything for anxiety, right? They've tried changing their diet, they tried exercise, they tried antidepressants, anti-anxiety medicines. They've even tried other, non-medication alternative medications like supplements, and it's still not working. So they may resort to cannabis, which has been effective for them, or they have common comorbidities associated with their anxiety. So pain is a common, medical condition that many of my patients may be taking medicinal cannabis for.
Right.
And it's managed, right? It's managed. But, it's complicated because, again, the school of thought, and when I went to fellowship and, residency, was that we just don't treat. And so these are, and at the time when I was in residency and fellowship, medicinal cannabis wasn't really FDA approved across certain states, including the state that I live in.
Well, and technically it's still not FDA approved,
right.
Unless you're using Marinol or Epidiolex or some of the other synthetic THC chemicals that we have.
Which is important because I really would you like explain that a little bit further, Dr. Sasha, because in my understanding, I had to get more research about that part as well.
Right. And so one of the things that many individuals don't know is we have had a synthetic THC drug called Marinol that has been FDA approved for many, many years. We're over a decade and more, right? And what that is a THC. It's tetrahydrocannabinol. It is the psychoactive component of cannabis. And we use that particularly in patients who suffer from anorexia. For example, patients who are cancer patients, terminal patients that lose their appetite, that helps to improve their appetite, but it also can help with pain. Now, it's effective for some, it's not effective for all. And so, for example, I've had patients, cancer patients, terminal patients, who have actually, they go through that wasting where they can't really eat, and so they go to hospice, and they've been put on Marinol to help them eat and Actually, I've had patients come off of hospice.
Yes.
I'm not
Oh,
saying
wow.
I'm not saying that's because of the marijuana. I'm just saying that, you know, they were able to eat. That, you know, because when somebody is dealing with cancer and you're not eating, like, you need proper nutrition to help get better, right?
Exactly.
But anyway, so that's one of the settings that we use it. You know, of course, chemotherapy-induced nausea, vomiting, it can be helpful as well. We have some other synthetic THC products that we can use as well for pain. And of course, most recently last year, the FDA approved Epidiolex.
Yes.
Okay, so that is a CBD product that is being used to treat Lennox-Gastaut syndrome, seizures in kids, right? So these are kids who are very debilitated. They're having lots of seizures. And we're here in, you know, in the hotel at Momentum in Medicine, by the way, conference in Atlanta. So pardon us if you're like having difficulty hearing. But we really want to get through this. And hi to everybody that's joined. I see Cindy's joined, Dr. Serena's joined. Thank you so much.
Hi, Cindy.
So we're having this conversation. So Epidiolex, you know, has just been FDA approved. So it's a CBD product. But as far as the medical cannabis that we see in states, in many states right now, we have about 33 states in the U.S. that have medical cannabis approved in some form or another.
Right.
We have just over, you know, 8 to 9 states that have recreational as well. And so that medical cannabis takes the form of either what we call a low THC CBD, which means it's 0.7% or more THC than hemp-based CBD, which is what everyone is seeing.
Okay.
I'm sorry, did I say 0.7? I meant 0.8. 0.8, sorry. 0.8%. And so the hemp CBD is actually less than 0.3% THC, and that, or less, right? So everyone's hearing about CBD, and those are the products that you're seeing that are coming from hemp plants. The medical cannabis that is coming to many states is the one that has a little bit more THC in them, but not as much as we may see in a regular cannabis plant.
Okay.
Which, for example, to give you an idea, you know, back in the 70s or so when, you know, folks were using cannabis, that THC range could be anywhere from like 3% to, you know, 3-4%. And now, you know, the cannabis that we grow now, especially for recreational, those percentages can be much higher, 10, 20% and higher. Wow. Now, when you do concentrated products where they take the compounds and they extract them and put them together, obviously there are medications or cannabis treatments out there that are high in THC, and so we utilize and modulate that level in patients. So we don't necessarily want patients using a pure THC product all the time at all. It's modulated with CBD, and then that's a whole other discussion that we probably don't have time to go into today.
And we should
and
later.
We should have a follow-up.
We should, yes.
But I think the focus is that, you know, for patients with anxiety, I think the point that you brought up is tremendous. A fair amount of anxiety does stem from chronic medical conditions. Yes. You know, if a patient's not able to function, they can't work, they can't take care of their families because of their health issue that is causing them to be debilitated, that can lead to an anxiety as well.
It can.
So you see some of those, right?
Oh, I see a lot of it. And how I explain anxiety is that it's connected to the nervous system. So when we're in pain, anxiety increases. When we're excited, anxiety increases.
Right.
When we're in discomfort, you know, you don't necessarily have to be in pain, but just not feeling well, anxiety increases. And just the stress of everyday life, you know, and like you're saying, Tasha, you know, all the demands that we have in our society, you know, I can understand how people can become anxious. Someone mentioned here, and we'll get to your question, Devon, about social phobia. And I have patients with that. And they just can't, like you're saying, they can't function.
Right.
And so, yes, it's very difficult. And we have treatments like benzodiazepines, which again, I don't use because of the addiction pathway.
Correct.
Right?
And that's definitely not something I reach for at all in my practice first line at all.
And benzodiazepines, I'm sorry, Dr. Sasha,
go ahead.
benzodiazepines would be an example of Xanax or Klonopin,
Valium.
And the only reason is because because usually this is reserved for acute care, like if you're hospitalized, then you'll probably get on benzodiazepines, but we're not doing a good job, I feel, as medical professionals in transitioning you from being inpatient to outpatient, because now you're on these medications. You're not seeing your outpatient provider, like psychiatrists like myself, for about 3 or 4 or 5, 6 weeks, if that. And then now all of a sudden you're out of your medicine, you're withdrawing, so on and so forth. And so commonly we resort to SSRIs, which means selective serotonin reuptake inhibitors. And this is kind of like the first line for us in dealing with anxiety and depression.
And we see that, so when a patient comes to me, sometimes they're on medications already, like SSRIs, and we really have to have a risk-benefit discussion, because one of the things that needs to be understood is that cannabinoids, which are the chemicals in the plant, they get processed through the liver through the same metabolic pathways that our psychiatric drugs are metabolized through. And so it's important when patients are on these psychiatric medications, we have this discussion.
Yes.
Some of the metabolic pathways can actually increase the levels of their SSRI. Some of them can increase the degradation of it. So when I have a patient who comes in, it's on an SSRI, I actually say, look, your psychiatrist needs to be fully on board and be aware of the cannabis, medical cannabis that we're treating with, because it could affect your treatment outcomes with your patient.
Exactly. And Dr. Sasha brought up a very good point. What she's discussing is how metabolism happens. So basically the breakdown of medicines. And so there's sometimes cannabis can increase the SSRI, sometimes it can lower the SSRI. So it's kind of like you're on too much, it's not getting the job done. So let's say you have anxiety, you have pain, right? And so maybe the SSRIs work well for anxiety, and then the medicinal cannabis is working well for pain. But like she's suggesting, you really want to go to an expert who knows how these interact, because you can have some significant side effects if they're not aware.
Right.
You're exactly right.
And the other thing that I want to mention too is when I have patients who come in who have any kind of mental health disorder or challenge or any kind of mood disorder, whether it be anxiety or depression, to me, I'm a primary care physician, so by trade, board certified. And so when patients come to me, we always talk about, okay, what's going on, finding out what the source of that anxiety may be, determining whether something like cognitive behavioral therapy can be helpful, and really getting that therapeutic aspect. Okay, so there's medications, but there's nothing wrong. But I always think, like, what is my long-term goal for this patient, right? So we may need to have medications on board, but sometimes learning skills that can help us deal with some of, whether it's social anxiety or anxiety that's stemming from trauma or a number of other things, this therapy can be so helpful as an adjunct. And, we want patients to have success long-term, okay? And yes, cannabis can be helpful. It is, at the end of the day, though, it is to make sure we're addressing things across the board for patients, and what other types of modalities of treatment can we employ to help our patients, right?
Yes, you're exactly right. And that's why I'm committed to learn more about it. I'm committed to even maybe take a couple of Dr. Sasha's courses to further, so I can actually provide a widening door for my patients who present with cannabis. Because as I stated, from coming from my clinical training, it was a no-no, to mix these two type of treatments together. And I believe part of that had to do with the research that really wasn't either, if it wasn't accepted or wasn't enough. There's so many kind of variables there, but the bottom line is that individual plans are different.
Sure.
And like you're saying, it's not for everyone, but it may be for someone. And it may be that treatment that helps them, maintain their employment, provide for their family, socialize and engage, and have some self-worth and self-meaning. And so that anxiety doesn't debilitate, but it actually prevents, it actually is not a factor in allowing them to function optimally. To have open minds and not be in our own tunnel, but to further expand our knowledge. Because I always talk to my patients that medicine is always evolving. So that's why we're going to continue to have these conversations and, kind of go forth with that.
And so when we talk about research in this field, right, many individuals know that cannabis became an illicit prior to that, we were using it in our compendium of drugs, the pharmacopoeia that we used to use. We used it prior to that. Now, when it became illicit or prohibited, we stopped. So what that did was it really put the brakes on research, valuable research that we really need, especially in fields like yours that is super complicated.
Yes.
And remember, Dr. Dawn is coming from an area that is, I always tell everyone, this is one of the most complicated places in medicine to employ and utilize medical cannabis. There are a lot of things to consider. As a family medicine physician, I have a subset of patients who struggle with anxiety or depression, but I see a lot of other patients with a lot of other chronic medical conditions that we do see tremendous benefit for those patients as well. So really, this discussion of how can we work together to help our patients, because I agree it's complicated. I agree that sometimes you will have situations of dependence and substance use. I actually, when I have patients that come to me, if I go through, I meet with them for at least 40 minutes. If I go through their history and I get a sense that this patient really has a substance abuse disorder, I let them know, look, I need you to see a specialist in substance use or abuse and dependence, because there's more going on here than what you're, as a patient you may not realize. There's more going on here, and really we want to get to the root of things, and we don't want to be using cannabis in a situation psychiatrically where it can actually worsen their condition. Exactly. And so I think I get to speak in so many circles where I help patients tremendously, and I need to do more live streams on how amazing it is. But I'm telling you, this is the one area that is like, oh my gosh. I mean, our gentleman here, Devin, said, I suffer from severe social anxiety and agoraphobia. Do you think medical cannabis might help with that? And certainly, disclaimer, this is where I would recommend you see a very qualified physician in this field to have a lengthy discussion about that. But if you're just talking about no other, straight social anxiety, agoraphobia, and you get to the root of that where this may be an alternative for you, my answer to you is actually yes. We do see that the cannabinoids can be helpful in that regard. I have actually patients who suffer, and I'm not advocating cannabis use for OCD, but the anxiety part of the OCD that keeps that patient, at home and not being able to go out is really helped with medical cannabis. Wow. And so for just that individual having to get out of bed every day and not leaving their home, or needing to do all these actions that stem from their OCD, they're doing so much better. And now they're able to get out of the house. They're able to go and interact and have an improved quality of life with this. And this is not a situation, this is, for example, and one of the patients I'm thinking about specifically, he is not a cannabis user, wasn't a cannabis user. So it's not a situation of, here's someone who's been using this drug and, is having this adverse effect. He came to me going, do you think this could be helpful? Wow. And so his psychiatrist is fully aware of what's going on. Yes. I am fully aware of what's going on. That's great. And his psychiatrist says, continue it. Yes. Because he's making progress. Now,
so it sounds like he was on medicines before. He's probably tried.
He's been on tons of medicines, and he's actually still on psychiatric medications. Okay. But the concept is that we have two types of physicians, the psychiatrist and myself, who are really tag teaming and looking out for this patient so that we can make sure that the treatment is effective. Okay? Because OCD is, you're the expert, but from a family medicine physician, OCD is a very complex disorder that I do not treat, and I rely on you guys, especially experts like yourself, to help patients like that. Yes. So I approach that very carefully, because those medications that they're put on, again, very complex. We have to look at metabolic disorders, all of these things. Metabolism, not metabolic disorders, metabolism of drugs. Right. And so just to give you an example. Wow. Wow.
So I just want to further kind of discuss what OCD is. It stands for obsessive compulsive disorder, and it's usually where a person tends to have ruminating thoughts, so that thoughts are that recurrent. They just go over and over again, constantly in their mind. Usually these thoughts can be in context of doing things over and over again for a particular number of times. So like excessive hand washing, making a certain number of steps, maybe excessive cleaning, contamination. They don't, and it's good not to drink after people, but these are individuals that may actually go to restaurants and ask for plasticware, for example, just because their anxiety provokes them to not want to eat anything that anyone else has touched. And usually, so the thought results in a behavior. And it's kind of like the pathway that I always talk about. It's kind of like you have the thought, you have the feeling, and it actually produces a behavior. Well, that thought actually creates anxiety, and that anxiety causes the compulsion. And so that's what Dr. Sasha is referring to when she mentions OCD, for those who are not aware of the acronym. And it can be, like you're saying, Dr. Sasha, very debilitating, where people don't actually leave their homes. I actually had a patient about 4 or 5 years ago, and she was a college student, and she actually didn't leave her home because she was cleaning. She obsessively cleaned her bathroom with bleach. It's like she couldn't get her mind off of her bathroom not being clean. And then the next thing in her schedule was to leave to go to class and then go for her day. So that's kind of when she got out of the shower, that's what she did. And it just stopped her from going to school. So, I mean, there are so many cases out there of different levels of severity that it could really affect. So I'm really surprised to hear. And this is kind of me as Dr. Dawn, and some of my patients may be on here, some of my clients may be on here. But, I'm really committed to learning more about this, because I'm, again, this is not my training, but that doesn't mean I can actually in the future start to work with individuals, international individuals like Dr. Sasha, and, kind of co-physician patients and help with their management that's going to be effective for them, because that's what we're here for. We're here to make sure that what we're providing for you is safe, effective, and has long-term benefits, right?
And something important to remember when we talk about medical cannabis treatment, people often ask me, like, what's the difference, Dr. No, about recreational versus medical, okay?
Yes.
And okay, so remember, I'm a scientist, I'm very factual, so, those of you who are my patients or know me, you know this about me, so I'm gonna just be real factual. Specifically speaking, the chemicals that are in a recreational user's cannabis and the chemicals that are in a medical cannabis user's cannabis is exactly the same.
Really?
Okay. What it has to do when we talk about treating it medically, now unless you're getting a high CBD product, or from a source that is just all CBD, okay, that's just one chemical. But the cannabis plant actually has over 400 chemicals, and 60 of them are structurally related to the delta-9 THC, which is the psychoactive component. But if you say, strictly speaking, what is the chemical difference, I would tell you a CBD from hemp is the same as a CBD molecule from a medical cannabis treatment option, which is the same CBD molecule from a recreational cannabis users. That the difference is when I treat patients, I modulate the levels of CBD to THC. Those are the two major ones that we actually, work with right now. There are great studies happening internationally that can expand that for us. But right now, the two major components that we're manipulating are the CBD and the THC.
Okay.
So, for example, some patients can have decreased anxiety with primarily CBD treatment.
So let me ask,
some patients need the THC.
Okay.
But we determine what level of THC we add to that CBD.
Okay.
We want to maintain functionality and cognitive function, physical function during the day. And we're able to do that with medical levels of cannabis, if that makes sense.
It does.
Like the products, for example, in our state. So I'm from Florida and you're in Texas, right?
Right.
And so in Florida with medical cannabis, we have products that are high THC, high CBD. And so as a physician, I can tell a patient, okay, I'd like you to use, let's try this much. My recommendation is this much CBD with this much THC, or I maybe won't add the THC at all. It just really depends on what's effective for that patient, and everybody's a little bit different. So chemically speaking, it's the same chemicals.
Yes.
How we manipulate those depends on the condition that we're treating, okay? So a patient may require a higher CBD product that may help with pain, anxiety, and inflammation, okay, and sleep. And there's a patient who may need a little bit more THC, maybe not to the levels that someone who's going for a high recreationally is looking for.
Right.
And that to me is where it's subtly different.
Oh my gosh, you just sparked so many questions. Okay, I have one question.
Yes.
So my brother is a forensic psychiatrist in LA, and when he was during his residency, he actually worked at a medical or medicinal cannabis clinic, and so he would actually evaluate and write prescriptions for these amounts. Right, recommendations. Excuse me, recommendations. Recommendations to where they can actually go to, pharmacies, because California is a place where they actually approve, I guess, medicinal
and recreational
as well. But how he was describing it to me, because we've had so many conversations about this, was, so can you talk a little bit about what is the plant or the leaf base versus the stem, or is there like different parts that are connected?
So wow, we're really going to get in the weeds on this one,
Yes.
right? And so the plant itself has multiple parts. Like there are, it starts with a seed, and some of the hemp-based products come from hemp seed. There's the stalks of the plant. Some hemp includes the product that we get from the stalks, and then there's the aerial parts of the plant that has the flower and leaves. So some hemp products or cannabis products will come from that. So it really depends on what part of the plant is being incorporated in a product that gives you insight into what you're actually getting.
So he was actually describing that, now this may be incorrect, so don't quote me, but like, for example, the leaf are commonly used, the flower is commonly used for anxiety, and another part of the plant may be used for depression, for example. I mean, or are the parts more concentrated with the CBD versus THC?
So it has to do more with the species of the plant and the strain of the plant.
Okay.
So that's where that goes back to. So what differentiates the strains of cannabis has primarily to do with the terpene profiles of the plant. And what I mean by terpene profiles is there are these chemicals in the plant, in the flower, that are like the essential oils of the plant. It's what gives the characteristic smells and tastes of the plant, right? So some of the terpenes that are in the plant are stem from like lavender, or like the same chemicals you can find in black pepper or citrus, like those oils that give the characteristic smell and taste of other fruits or things that we have are actually found in, I'm trying to be super basic here, guys, so that are found in the plant. So it depends on what the strain is for that. Technically speaking, the flower will have your highest amount of cannabinoids, because those are contained in the trichromes of, so we're getting super, like on the cannabis plant, you have these little droplets of chemicals that really provide the terpene profiles for it. Now, once you get past the flower, what's contained in the stalk is very different in terms of content of CBD and THC.
I see.
Okay?
And the reason why I brought that up is because I did have a patient, or a couple actually, who actually the doctor actually recommended like cannabis, and they were really interested in how not to become addicted to the product, and they wanted to know specifically, if I were, I am a patient, for my ADHD, and I want to know how this medicine is going to, respond to my brain, and where is it coming from, and what is the long term, and all those things. So that's kind of why.
So that's a complicated question, because when we talk about using any kind of treatment that can feed into either abuse, dependence, or addiction, right? We have to be aware of those patterns.
Right.
And so if we digress a little bit, we can talk about that in the sense that patients who have levels of cannabis use that are high levels of chronic daily cannabis use, that have high levels of THC, that's going to feed into those parts of the brain, the parts of the brain that make you want to use again, right?
And that stimulates the dopamine. Remember the dopamine we
feeds
constantly
in
talk
that.
about?
Yes,
the reward
feeds
pathway.
into that reward pathway of the brain, and so
people can actually become anxious, right? It's
okay, so that's the other thing, right? So if you don't use cannabis appropriately, it can worsen your anxiety. I see it. It's one of the known potential side effects. This is why, guys, that you really need to find a physician who is super knowledgeable about this, because it's not as simple as Google or any other website is going to make it out to be, okay? So I want to say hi to some of the people that have joined, actually. So I see Jason's joined, Vinny's joined, Dr. Deanna, she's all the way here in oh wait, you're in Ohio now, I think. We have Katrina. Hello to you guys. Thank you for joining.
Yes, Dr. Serena and Devin, thanks so much for your questions.
Yes, fantastic question.
Yes, excellent question. Hi, Monica. Hi, Laquita. Thanks so much for joining. And Michelle and Dr. Janelle, who's also here in Medical Moguls in Atlanta.
Yes.
Thanks so much for joining us. Yes.
So anyway, so I think that when a patient is using high levels of high THC daily, that you can start building the tolerance, then you have to use more, and then that can feed into a dependence pathway, because your body can become tolerant to cannabinoids. One thing I'd like to point out is the endocannabinoid system, the system that's in your body, that produces your own cannabinoids, actually just fires on demand, okay? It's not a system that's firing all the time.
So did you all know that your body naturally produces cannabinoids?
Cannabinoids,
yes.
Cannabinoids,
yes. Excuse me, mispronounce that.
No, it does. It actually has its own endogenous, inside the body we produce these chemicals that are very similar to what's in the plant, okay? That's why the plant can be effective in the body. Now, these cannabinoids are actually involved in so many functions throughout the body. You know, I had a shirt last night.
Yes, I did.
So I had the shirt. So I had a shirt last night that says medical cannabis, because usually people call it a gateway drug, and so I had gateway, but I scratch off way and put keeper. So it's a gatekeeper drug for health and wellness. And the reason I say it's a gatekeeper drug is because we have found that it's been involved in so many physiologic systems in the body. And the more research we do, the more we find out. Now, whether it's beneficial or not, it's beneficial in many ways. I'm sure as we get to do more research, we will find out even more.
Yes.
Okay? But that's why I call it the gatekeeper drug, because it really is involved in so many pathways in our body physiologically.
Wow.
But what was I saying? Now I'm like, I was going down the pathway of the endocannabinoids and just talking about dependence, right? So, right, thank you. Hello, thank you. So, what I meant was if, the endocannabinoid system's firing as needed. So when we have patients who are using the treatment, patients that need high levels of cannabinoids or high levels of THC to manage their medical conditions, we talk about taking breaks. Okay, because those receptors that sit on the cells that the cannabinoids bind to will internalize if it's constantly being hit.
I see.
Okay, so remember, just kind of like the opioid pathway, different pathways where the receptor, you become tolerant
to it. Exactly.
So that can happen. And mind you, the percentage of dependence and addiction that stems from cannabis is much lower than people do make it out to be. Let's be realistic, right? It's actually, it's easier to become dependent on caffeine than it is on cannabis.
And I see that a lot because of the ADHD.
Right.
And
exactly. So
it's a stimulant.
Yeah, it's a stimulant. So keep that in mind. But actually, we do have to be mindful of that. So I have my patients take holidays off of their treatment.
Interesting.
There are a few medical conditions, though, like movement disorders, like Parkinson's and Huntington's disease, that those patients, if you Google it, if you don't know what that is, these are patients who have movement disorders that is involuntary, they can't control it, and it leads to a lot of other issues. And so those patients we treat with we tell them try to stay on it as all the time.
Wow.
Because if their involuntary movements are happening constantly.
Right. So what has been your response in someone who's Parkinson's?
Tremendous.
Can you give an example of what you've
So,
observed?
for example, I have many Parkinson's and Huntington's patients, but my patients who have the tremors, for example, the involuntary movements, they're calmed. So imagine this. Movement disorders come in different forms. So like a Huntington's patient who has what we call chorea movements, right? So their body is moving, everything, every part of their body is moving all the time. Within 2 minutes of them inhaling medical cannabis, they will be calm. So I had a patient in my office once who they travel like 4 or 5 hours to come see me, right?
Okay,
Because,
yes.
you know, I get all the difficult patients in Florida.
Yes.
I mean, in the sense it's complicated.
Yes.
And so I had a patient who traveled like 4 hours to come see me, and they had not used a Huntington's patient. They had not used their treatment, and they're in my office, and they're just having their career movements. I felt so awful for them. I said, when was the last time you used your treatment? And they said, yesterday. Because, you know, we were coming here today. They weren't driving. Somebody else was driving them. And I said, please use your treatment. Now, I had a medical student in the office, and I called my medical student and I said, I need you to see this. Mm-hmm. And so the patient uses their treatment and goes from this involuntary movement all over the place to just
this
sitting
is
there
huge.
and having a conversation with me.
So what? I mean, are you involved in this research? I mean, how is this expanding? Yes.
Oh my gosh! I mean, there is a lot of research happening, and that's the thing, right? A lot of people don't realize there's a lot of research happening in this field, and has been for a long time.
Right.
Okay. So yes, I mean, this is where like looking at how, and now imagine this Huntington's patient, their anxiety. I mean, they were on medications for anxiety and depression. Of course, they're depressed because the condition is, I mean, that's a terminal illness. It's a terminal illness, right? So
I want to actually go into kind of the opposite realm, but kind of stay on the topic, if we will. So because I'm a child adolescent psychiatrist by trade, and I don't see these type of patients with Huntington's because they're the elderly, so that's more for the geriatric psychiatrists. But I actually have moms in my group, in my my Focus Builders Super Moms group, and these are moms who parent children with ADHD, and me and the other moms of the group have ADHD itself because they're asking questions, and some actually are doing it, is that they're giving their children cannabinoid oil, right? And the response, because I'm just interested, because there's really no research in cannabinoid oil in ADHD. It can be seen unethical just because they're kids. I mean, you know, there's in the psychiatric field, but of course this is where this comes involved.
Because
we need
parents,
more understanding
some parents
and learning.
Do whatever they can for their kids, right? But
because they tried a lot of things. I mean, I had parents who've tried a can of soda every morning because the stimulants were causing them to become a zombie, or it's causing them to have worsening behaviors. So they found that, you know, caffeine as a stimulant is helpful. But then, you know, we talk about, well, the long-term risk factors on the heart and the blood pressure and how there's a lot of sugar and salt, you know. But many patients or many moms, I've heard this over and over again. They ask me, well, Dr. Brown, how do you feel about cannabinoid oil, you know, for my son? And so, you know, I have to tell them, well, you know, it's not, I only treat with FDA approved agents. I'm an ADHD coach, but again, I'm more about learning so I can provide information and insight. And so this is kind of why I would defer to you, Dr. Sasha. I mean, have you ever had that type of question? Or
I have had patients, parents come to me.
I know we're talking about anxiety, but this is important because anxiety is very common. I'm sorry, Dr. Sasha, I didn't mean to cut you off, but anxiety is a common comorbidity of ADHD. It's actually number one. So what that means is that if you're not treated for your ADHD and you have it, or you're subtherapeutically treated, so you're not treated properly, you're likely going to have anxiety. And there are patients who have anxiety and ADHD that need to be treated differently. So sometimes they don't connect. So that's why I'm bringing this up, because sometimes we don't just have one condition. You know, we have multiple. And so I think
they can build on each other.
Exactly.
So I have had patients, moms bring their kids in, and oops, our battery's running low. We're going to take a quick pause here so we can stay connected.
See why?
We don't want to lose you all. Thank you all for joining.
I don't know why this is...
If you just joined, this is Dr. Sasha. I am your dual doctorate, board-certified, award-winning physician and researcher, best-selling author, international speaker, and medical cannabis expert. I am here with Dr. Dawn, Psych, MD. She is the International ADHD Expert, and we're actually talking about anxiety. And now we have transitioned a little bit into anxiety and ADHD because of how they are related.
Yes.
All right, we're having a little battery deal here. So this gentleman here is helping us. We are actually at
just put it down here?
The Momentum in Medicine Conference in Atlanta, and wanted to take some time to come on out and speak to you all. Looks like your battery's running low. We're actually trying to dual Facebook.
Oh, no!
Let's come back on.
Okay.
Log back in.
Yes.
Okay. You know what? I'm gonna log back. I'm gonna log off, guys, and I'm gonna log back in.
It did work.
Oh, it did.
It did. We just have to do a
super.
part two. That's okay. Okay.
All right. Thank
you, sir.
All right. I'm gonna log back in. I'll be right back so we can continue this conversation.
Yes.
Thank you so much for joining us, guys. We will be right back.
Thank
Part
you.
2.